Well, good morning, everyone, and thank you so much for joining us for part 2 of the webinar, Return to Work, COVID-19 Employment Policies and Best Business Practices. I certainly hope that you were able to join us yesterday for part 1 of the series. It was really terrific content. And of course, this webinar is sponsored by the Salt Lake Chamber's Roadmap to Recovery Coalition. I'm Linda Wardell, General Manager of City Creek Center, and I'm also a member of the Roadmap to Recovery Coalition. And just in case you don't know what the Roadmap to Recovery Coalition is, it's a business-led coalition focused on implementing and promoting our economic recovery. And of course, I think we've all been super focused on doing that for our businesses throughout the pandemic. You know, certainly a lot has changed over this last year. We've had to pivot from what we were used to and from, you know, an economy that was performing so well to the realm of the unknown. And none of us in the business world like uncertainty. But as Utah's economy is bouncing back, and we're seeing that more and more every day at City Creek Center, we've got businesses that are outperforming even what they were doing in 2019, and we're so excited about that. Our vaccination numbers are increasing and positive COVID-19 cases are decreasing, which is my favorite thing to say. But businesses are wondering how best to return to normalcy. And we need to adjust for sort of the new way that we work because really so many things have changed for us. So today we have a terrific panel for you. We've got a panel of experts who are really going to be able to just answer so many questions for us, I think, and I'm excited to hear what they have to say and to learn from them. We have Joe Cannon, who's the COO of Young Living Essential Oils, Sherry Jones, who's president and CEO of Ameritech College of Healthcare. We have Marie Colbeth, General Counsel and VP of Legal Product for 650. If you were here yesterday, you certainly saw Marie and all the great things she had to say. We have Lavanya Mahate, who's the owner of Saffron Valley Restaurants, and she's joining us today from New York. We have Sterling Nielsen, President and CEO of Mountain America Credit Union, and Analise, who's General Counsel of Ivory Homes. So panelists, thank you all for joining us today, and we're excited to hear from each of you. Just a reminder for anyone who's joining us today for this webinar, if you do have a question, please submit it using the Q&A function. I think we've all been on enough Zoom calls now to know how to use the Q&A function, but we'll do our best to answer as many of your questions as we possibly can. And we definitely want this to be interactive and participatory, so please don't be shy about sharing your questions with us. So panelists, this question can be for any of you. I'll know that you're ready to answer if you unmute. But could you please share with us how your return to work plan fits into your overall business strategy? Okay, now you can't be this shy. Somebody's got to go first.
I'll go first if nobody else wants to. A lot of people did hear from me yesterday, but I'll say ours fits in 2 ways. One is we actually have a product that is helping other companies return to work. So as we decided how we were going to do it, we decided to monetize and share that with other companies. So that's been a big part of it for us, but also overall, as we've decided how to go back to the workplace, it's really impacted some decisions that we're making about, you know, what degree of our workforce is remote, and making decisions about, you know, not requiring people to come back into the office full time and allowing people to continue in a hybrid way. So we have, in fact, really changed a lot of what's going on in terms of expectations about in-office time for all of our teams.
That's terrific. And Joe, did you have something that you wanted to share?
Yeah, first of all, I also wanted to say that I've got on the line as a participant is Jean Schreckengast, who is our Chief Human Resources Officer and who's way smarter about this than I am. So I don't know how we can work it in. Jean, if you're on, maybe you can like say something if I go off the rails here. But I guess the answer, part of the answer to the question is that we, like everyone, so I'm not saying anything that everyone hasn't experienced, this whole COVID shutdown thing has taught us a lot about how we work with employees, how we manage employees. And I think almost everybody thought, and we did very systematic surveys of our own employees, as well as looking at the companies around us, who one way or another, we're all competitors for employees. So a piece of this, has to do with, okay, how do we operate within the workforce availability of our state, just here locally? But we think it's a competitive advantage to be very flexible in how we approach work. So there are, we have a whole plan of how to do this, but basically it's very heavily weighted to flexibility and people coming in when they can come in, when they want to come in, and working around their schedules. Whereas I'm sure everybody is working with like office hoteling, so that you don't have one space that's empty 30, 40, 50% of the time. So for us, we see it as a benefit to our employees, a benefit to us. We've seen, as many of you have, productivity gains in how people are working this way. So why not keep at it? We feel it'll be a very small and maybe close to 0% of people who will always work from home. There are a few jobs like that, but most jobs will involve some coming in. But the overwhelming percentage of our employees wanted this flexible approach going forward.
Joe, that is interesting. You talk about being flexible and things that you've learned from, working with employees during the pandemic. I've learned, from managing employees through the pandemic, that we need to be as flexible as possible with employees, but also that we need to be very specific about the outcomes that we expect. Because unfortunately, I think some people with, the assumed flexibility, if we're not clear about the outcomes that we expect, we may not, get what we expect. And it could be a little different in my business because, of course, we continue to be, open and operating throughout the entire time. But I just think that crystal clear communication about what it is that the business needs, in addition to what, we want to do to be flexible for the employees, has been so important. So important.
A good deal of what we've done is training managers on how to manage in this new environment. That's you're right, a pretty key fact. This isn't working 3 days a week and then not working 2 days a week, for example. It's not that.
Exactly.
I wouldn't mind that personally. There's no way I'd get all my work done though. I wanted to weigh in on that a little bit too, with the flexibility side and expectations. That can really go in two different ways. I've seen both with my own company and with the companies that we are service providers for. Some people may take this as like, oh, I don't have to work as much, but we've seen a lot of our employees working so much more. And so we actually had a meeting just a couple of weeks ago about, as an executive team, about, okay, we're going to, we're going to have an announcement and we're going to talk to our employees about, you need to take at least 1 week off, like a week, because people aren't taking the time they normally would take, and they're working a lot of times longer days because they're at home. And so, also creating that culture where people understand that they are not expected to be on 24/7. It's nice in a lot of ways as a company, but your employees get burned out. And so being aware of the culture in both directions with the expectations.
Fantastic. Sherry, do you have something to add?
Yes, I would love to just share a little bit about how it's influenced our strategy as an institution or as a college. First, I'll comment on how it's influenced the college from a student-facing perspective. So, online or virtual education isn't new. That's been around for a couple decades now. But what we found was we really had to pivot around some of the key things that our students would do, such as, while online education has been around, and even hybrid education, things like remote testing weren't as common, right? There were certain key events that would happen each semester that were typically still very much campus or location based. And so, COVID certainly helped us accelerate some innovation and things that we were testing. And so now it's influenced us from a student perspective or from a customer perspective. How do we continue to support in a flexible and innovative environment, things like remote testing? From an employee perspective, and we've heard a lot already from, Joe and Marie on the employee perspective, we've also learned, I would echo everything that's been said around flexibility and so forth, but we've also found ourselves talking a lot about hybrid work, and we've been hesitant to lead with too many rules and policies and procedures, wanting to allow time to see how things evolve. And what we've learned is that most people don't want to be exclusively remote, nor do they want to be exclusively on ground. And so how do we talk about that, and how do we help that inform our decision making while still meeting, college, fulfilling the college's mission, right? And so that's influenced our overall institutional planning and institutional strategy, in that we talk a lot about rhythm. And this isn't something that I've really spent time talking about before in institutional planning, but we talk a lot about having a rhythm-based approach so that we can best support faculty, students, and staff, right? So looking at where are the rhythms. So rather than, and this may work for some organizations, some organizations are saying, okay, you can have a remote day Monday or Friday, but we want you, present on these days. And that may work really well for some organizations. Rather than take that sort of approach or to rush into policies and procedures around it, we're trying to take the approach where we're looking at what is the rhythm. So week one of, say, new semester, maybe a midterm, maybe the end of the, the last week of the semester, break weeks, right? What does that look like? What is that rhythm? And so that helps us talk about the flexibility, the support, the expectations a little bit more holistically. And so far, those conversations have been healthy, sometimes spirited, but they've been healthy for us. And so I'll say, as an organization, I think we've also gotten better at having some of those candid conversations because of the context.
Yeah, that's great. Well, Sterling, do you have something to add?
Sure. If you look at our situation, it's a little bit different. When you talk about returning to work, most of our employees are in branches. We have a very high touch type service model, and they were already there. But if you look at the corporate aspect, yeah, we did go home, and we did because there's a little bit closer proximity, and we needed to make sure that the employees were kept safe there. Of course, in the branches, we had great success. We didn't see the transmission if we were following the safety protocols, and so we were very proud of how things went there. But if you look at the coming back, one of the key considerations, I know there's a lot of talk about flexibility and wanting people to continue to work in a hybrid or remote environment. And I think that's great, but we expect that people, when they start to actually do it, they're going to figure out what they actually were missing. There is a human component that we have been missing. And I know that we think we replaced it, but I think we've forgotten a lot of what we're missing out in this new environment that we've kind of adapted. And I think you're going to see a lot more coming back. So although we offer the flexibility, we're certainly not going to be getting rid of desks immediately, because we think a lot more are going to be coming back. Another aspect of this that has us, we're working on is the culture. We want to make sure that we maintain our culture, and it's really hard to do that when you have so many remote, particularly as you have a lot of new employees come on that don't understand the culture. And you hate to see that culture erode because you're offering too much flexibility. So that balance is critical as we go forward and getting people coming back.
Yeah, it's so funny that you would say that, Sterling, because I think the biggest problem I have most of my team back in the office the majority of the time now. And the biggest problem that I've had is keeping all the little chickens out of my office, because they're just so happy to be back and they're so happy to be together. I'm like, get out, I have to work, I can't talk to you. They've really missed that interaction, and we've all missed being together. So you're absolutely right. Lavanya, did you have something to add?
Yeah, so our industry is also slightly different, where we were always there even through the pandemic, except for a few weeks that we had to close. From a business perspective, I think we've seen how takeout and delivery has grown in volume as compared to dine-in, which is slowly coming back. So restaurants are, rethinking their models and, gearing more towards, with so many concepts of ghost kitchens and cloud kitchens popping up, how they can leverage their resources without having to pay high rents on spaces that are not being fully utilized for dine-in is definitely a big question on operators' minds. But I feel like it's just a transition period we're going through, and dine-in will come back, and it will come back big. So it's important for operators to just stay the course and be slightly patient, where we're working with the government and the communities and the chambers of commerce to get through, the transition phase. From a concept perspective. From an employee perspective, we definitely are seeing shortage in trained personnel. That continues to be an issue, where we are focusing more on cross-training employees and using shared resources between our locations, and also offering flexible shifts. So and working on that culture again, where people want to be a part of the company and be supportive through these times. And then from a customer perspective, it's important to restore and regain customer confidence, and also be respectful and mindful of everybody's preferences, where vaccinations are concerned, wearing masks are concerned, where it's no longer a mandate, but just being flexible around customer preferences, because it is a service industry after all, and we got to get through this transition phase. Is my opinion where we are right now.
That's great. And thanks to all of your employees who've been, on the front line. It's not been an easy time in the restaurant industry, for sure.
Yeah.
For sure.
Thank you.
All right. Well, so I think one of the things that is interesting is I'm starting to hear companies downtown that are coming back to work talk about different benchmarks that they have in their return to work plans. It may be helpful for people to understand if you have different benchmarks established in your return to work plans and what those are, and sort of what they apply to. Anyone have anything to share about that?
I can share a little bit on that if you'd like. And once again, we don't claim to have the answer to a lot of these things. Like most of us, we're trying to work our way through and make sensible decisions based upon the information we have. But one of the things we did, particularly as we were looking at lifting some of the restrictions in our corporate building with the number of employees we've had here, and also the wearing of masks at desks and things like that, is we wanted to look at what level of exposure we have. And so we did an anonymous survey. Once again, anonymous. We didn't collect any specific data on anybody, but we wanted to find out who had vaccines, who had been vaccinated, who had the virus and have antibodies, who's planning on being vaccinated or in the process of being vaccinated. And we wanted to get that information in order to help us decide when it's good to pull the trigger. Based on the information we received back, it was better than we anticipated, and we decided to lift our restrictions and allow people to come back in the office. And it's worked very well. We did that a few weeks ago, and people are coming back. And once again, it's not a rush back. It's just come back as you feel comfortable. Masks are still welcome, but you're not required to. And it's actually worked very, very well. We're pleased with the results we've seen so far.
That's terrific. Yeah, we're doing something sort of similar here. We're still wearing, we don't wear our masks in the office, but if we go out into the center, since we still have signage that says masks recommended. If I go up into, the retail center, then I do put my mask on. And of course, you're not required to wear a mask at City Creek Center, but, because we have the recommended signage, we want to support that, right? If we're going to tell people masks are recommended, then we should be wearing them. So we're sort of the same way. Joe, do you have something to add?
Well, I mean, we did some benchmarking by looking at PwC, and I'm sure a lot of you already saw this. They did a big employee survey and, established some guidelines. We have said we're pretty much the same as everybody. If you want to wear a mask, you can wear a mask. Not too many people, in fact, wear masks now in the office, but and we're fairly loose. People are starting to come back, but our deadline, not deadline, our time for fully implementing the whole flexible workforce return is August 2nd. So even those people are kind of migrating in and out, and you see a few more cars in the parking lot, I think we'll see a good deal more of that starting on August 2nd. You know, one thing that I'm not sure this is the right thing to say, right, even the format, but I wondered myself, I'll just talk about my own perspective. Well, you know, I don't work 8 hours a day at home. And so how do we track that? And then you know what I thought? I probably shouldn't say this. I don't think I work 8 hours a day in the office either. Like, what constitutes work? What is the thing that you're measuring? And I think that's forcing us to think about a lot of different things. I did want to go back to one thing that Marie said, which is, yeah, when am I not at work? That's the real question. Literally, I got a text last night at 1:30 a.m. So I know we have people all around the globe, but yeah, I think it's forcing us to think a lot about what constitutes work. What do you actually, what does it mean to say that I'm working from home? Or what does it mean to say that I'm working in the office? Am I working here, or am I talking to my pal down the hall? Is that work? Well, yeah, it's sort of work. And it's part of that thing that Sterling was saying, you know, there is this sort of connectivity that you can never really get through Zoom calls. So I don't know, I think it's really forcing a rethinking of that. What does it even mean to be at work? And I apologize to the people for whom there's no question about that. If I'm a teller at one of your facilities, Sterling, I know what working is. I'm working, I got a workstation. If I'm a server, but for a lot of regular white collar working in the buildings that of the employees that support all these other activities, I don't know. I just think there's going to be some interesting rethinking about what even constitutes work.
Yeah.
And I think we're going to find it, unfortunately, it means a lot more times than we thought, like Marie was talking about. When am I not at work? I ask myself that all the time.
Yeah, I was actually thinking as you were all talking about these, like everything you mentioned, I'm like, I've seen that at my office. I've seen that at my office. Like, but one thing that we're doing, and I really appreciated Sherry's comment about, like, we're trying to see what the real reality is before we put too many rules and restrictions in place. But our company, because of the nature of what we do, like we create these products that, among other things, like automate employment policies. So as we've been creating those, you know, we've been surveying our employees and testing them and all of this. And so we've started putting policies in place, and those really have helped us to figure out, like, yeah, what is work? What are the expectations? What are we actually doing here, right? What is everyone doing? The survey tool part of it has been so important. I love that people are surveying their employees now to find out this kind of information. But we've also been doing it. You were talking about benchmarks. Like, we've been doing it also with vaccines. And I know, you know, there's pros and cons to actually having your employees report whether or not they're vaccinated. And the biggest pro is that it really helps your risk analysis, just like you were talking about with the anonymous survey, Sterling. It's so helpful for the risk analysis. But if you collect it not just anonymously, but also with the name, you're able to put in place rules. If you want to say, we're going to adopt the CDC guidelines, which means if you're not vaccinated, you still have to wear your mask. If you are vaccinated, you can take it off. But if you're going to do that, you kind of need to know, well, who's vaccinated, right? So it gives you an additional step towards saying, like, we're definitely following the guidelines, so that lowers our risk. But now we have this additional data, so we need to make sure that we're storing it appropriately. It's not connected to the personnel records because it's, you know, ADA requirements mean you have to keep it separate. So there's a lot of things you have to put policies in place to handle while you're figuring out, like, when we decide what our benchmarks are, how are we going to implement the policy, right? And I think that's a big part of the administrative headache right now for so many companies. But I also think it's been really valuable. Like, we've done risk analysis like we never did before. You know, we've started thinking about not just COVID, but other risks associated with our company. You know, security risks generally. We recently changed all of our locks and gave every employee their own access code. We'd never done that before in my company. So, like, a whole new level of like risk analysis and policy making based on experience, and sort of being nimble in a way that I think a lot of businesses weren't before. We know we're a small business. You know, we're right about 30 employees, and, you know, we've been growing. We're only a few years old. And I think most businesses of our age and size probably haven't ever really implemented this kind of policy this early before. But I think it's the new way of business, is having to think about these questions and plan for things that we used to, well, I don't think we ever used to think about, right? So that level of flexibility from the administrative side, not just from the side of giving people flexible schedules, I think is really important.
Yeah, I really appreciate your comments on risk analysis, Marie. I think it's very wise and a whole new perspective that some business leaders may not have had the appropriate bandwidth to consider, while we've had our hair on fire during the pandemic. But very sage advice. Analise, did you have something you wanted to share?
I did. 2 points following up on Marie's comments. I liked how you ended with that, the importance of risk analysis and the value that rethinking your policies can have. I think that one thing Ivory Homes did really well during the pandemic is communicate those new policies. Since they were changing so often early on, we were having weekly team calls with Clark Ivy, our CEO, was talking to all of our employees, and we've got so much feedback about how comforting that was, that they knew exactly what our expectations were, they knew what was going on in the community, and then even outside of our own employee base, we also organized a lot of those same team type calls with our subcontractor base. And these are companies that a lot of times are smaller, they're not as well connected, and we got so much feedback about how grateful they were that Ivory, as a leader in the industry, would gather all of our subcontractors together and tell them what our expectations were and how we could help them navigate the pandemic. I think that just brought a lot of comfort and predictability to those early days that were so scary. And then on the idea of benchmarks, we really relied heavily on the state and the CDC to set those benchmarks for us. So we really just carefully monitored what the guidance was and nimbly changed our own policies to match whatever the current advice was. But I will give a shout out to 650. We did take advantage of that great benefit through the chamber to be able to work with them on our own vaccination policy. And that was definitely a value add for us, in that we did decide that we would incentivize vaccinations and we would track those vaccinations with those parameters that Marie talked about. And that's been really helpful for us as an organization to know exactly the percentage of our office that's vaccinated, the percentage of our field teams that are vaccinated. And I think that's just really valuable information. So I'm grateful to the chamber for providing that opportunity.
Yeah, that's a terrific story. And, kudos to Ivory for communicating with those subcontractors. You think about those, tiny businesses without access to all of the information and resources that you have. And, thank you for doing that and helping all of those people. You inevitably saved lives through what you did. So that's just a terrific example. Sherry, do you have something to add?
Yes, and I'm also curious if others run into this issue. I know where we sit with our organization being a healthcare focused institution, we reached sort of herd immunity, or that highly vaccinated space, really early, right? So our students, our largest program is our nursing program. So all of our students essentially become vaccinated, as do, a majority of our faculty, if not all. And through self-reporting, we are very quickly, in that very highly vaccinated, by highly vaccinated, 80, 90, 95%, plus range, which certainly helped with our planning. But in terms of benchmarks, what we've had to be really mindful of is that those who aren't vaccinated, and because in most of our instances, people are the people who are part of our community are typically required because of the work they do to be vaccinated. So if they aren't vaccinated, it's likely because of some specific reason, which means they're very high risk. And we wanted to make sure that as a community, we maintained openness and safety for those who are highest risk and unable to be vaccinated. So some of our benchmarks included making sure that we were really mindful of that population, regardless of how small or how large it is, and that we reserve spaces. So yes, we have mask-free zones, but we also have areas where, it is still masked and still using, some of the guidelines and things to help protect and make sure that our highest risk folks always feel comfortable and safe and know know that there's that opportunity. So it's maybe more of a question. I'd love to hear if anyone else had that situation, around how you do reach out and benchmark for the highest risk people who maybe aren't able to be vaccinated.
Great question. Anyone have a response to that? Marie?
I feel like I've talked so much.
It's okay. You have great information.
It's just because this is what I've been doing for my job, right? Every day. One thing I would say is if you're collecting vaccination and information anyway, you also should have a way for people to report exemptions. So if they have a medical exemption or a religious exemption, and that way you'll know what that high risk category is, and it'll give you an idea of what amount of space you might need to allocate to create those zones where still everybody needs to be masked, everybody needs to be socially distanced, or determining whether the best accommodation and the safest approach is to have those people still be remote. But again, given like the type of industry you're in, that may not be an option because it's no longer fully remote education. Now people are coming back. So that may no longer be a good accommodation. So that's something to think about. We talk a lot about accommodations when we work with our customer base, because that's always the biggest question, because you can't make one policy and then say no exceptions, because legally you have to make exceptions. So finding out the size of that population, so you have an idea of what sort of space allocations they may need, can be really important. And then talking with them. So once people inform me of their exemptions, if it's a religious exemption, that's one thing. If it's a medical one, they could be in a higher risk category. And so it is appropriate from a legal perspective to do follow-up to make sure that the accommodation that you settle on is the right one that really does help mitigate the risk. So again, some people are so high risk that the best accommodation may be a remote option, but there's a lot of other people who they still would be able to come in if everybody's following appropriate, distancing and masking guidelines. So, and it also could be, again, like a numbers question and a space question. If it turns out that the only people that have requested exemptions, everybody else is vaccinated, and the people that have requested exemptions are all, in the same department or on the same team or in the same space, that could be the space that's treated differently. But I mean, it's rarely that easy, right?
Yeah, definitely. Anyone else have anything to add on that topic? I had a fellow manager call me yesterday who was dealing with a problem in his office because there was someone who still needed to wear a mask because of a medical condition. And he was being treated poorly by some other coworkers because they were making assumptions about this person that weren't true. So they were being treated badly for still wearing a mask. And so I think, there are going to be some new types of, I guess you would call that harassment or discrimination that we probably haven't seen before as leaders in the workplace that, we're going to have to think about managing those as well. So, just all sorts of new things, coming at us that we haven't contemplated, that I think we're going to have to, again, be nimble and creative in the way we lead. So we talked a little bit about communicating our plans internally and externally with employees and customers and different stakeholder groups. Does anybody else have an example of the way that they've been communicating their plans? Because I think what Analise gave us was such a creative example of that. Does anybody else have an example of the way that they've been communicating their messages, Sterling?
Well, I'm becoming a little bit of a videographer. I set my iPhone up on my water bottle and use my watch to turn it on off. And so I've been making videos, and I think that's been the way to communicate. It's worked very well. Just do a short message. And one of the messages actually did address the topic you were talking about with masks and not drawing conclusions about people wearing masks, and to be understanding. And to respect that. If someone's wearing a mask, match them. Don't just say you're weird. Just, hey, you're probably concerned. Here, I'll help you out. I'm going to wear a mask as well when I'm working with you. So I think we need to work together as a team. We're part of a family, so let's treat each other appropriately. But the videos have been very well received, and it's been a good way to communicate. There's so many changes that have been happening throughout what has been going on for the last year and a half.
Yeah. Sterling, I think that's great. I think you're setting, just like Clark Ivory, you and Clark would make, your employees feel terrific. Just having that direct contact from you gives them so much confidence, in the messages that you're sending. So, that's certainly setting a very high bar for any organization. So thank you for doing that. Joe?
So we held a series of webinars in pretty small groups for managers, just so there could be some interaction, Q&A, and then we've also done a video for all the employees, not just the managers. So I don't want to put myself in the category of Sterling or Clark, but we did a video. I didn't do it, so it's more of but yeah, we're trying to make it as easy as possible for people to understand what the new system would be like, how they could fit in, and just so they feel comfortable coming back at whatever level they're going to end up coming back. But it was really key to us to train our managers first, so they could really feel comfortable about it and how they would interact with the rest of the employees.
Yeah, I think that's terrific. We've been doing some similar things. We've had our CEO who's been hosting, regular policy updates. He's had meetings where, employees have been able to ask him questions directly, which he does quarterly anyway, but he's increased the frequency of those. And on top of that, we've also offered in small groups, we've had some what we call employee assistance seminars. And I think those have been very helpful for our team members. So they've been meetings about, how to better manage stress and, specific types of stress that, have been certainly pervasive during the pandemic. And our teams have really enjoyed them, and they tend to all be sort of type A, go, kinds of people in our business, because we do work long hours and run around a lot. And we weren't sure how they were going to receive these messages at first, but they're really looking forward to them. As soon as we finish one, they're like, when's the next one? And what's the topic going to be? And so we've really enjoyed those and decided that we're going to continue them, even beyond the pandemic. So that's been, a great thing for our group. Analise, do you have something to add?
Yes, I just wanted to second that. It's a little bit of an unexpected outcome, I think, of returning to work, but there's definitely a new openness and ability to communicate about mental health issues. We've rolled out some new resources for our employees, and it's been neat to see. And maybe I think the construction industry is maybe the most stressed out industry right now. There's certainly a lot going on, a lot of cost increases, an increase in demand. But thankfully, there's also this new willingness to talk about mental health and to support employees' mental health in the workplace. So I guess if that's one benefit that came out of COVID, I guess that's something we can be grateful for. Hopefully not the issues, but the willingness to talk about it at work is, I think, a positive thing.
Yeah, I agree with you. It's people that I never would have thought previously were willing to discuss these types of topics are now just open books and sharing. And so I agree with you. I think it's a really terrific thing to see. Anybody have anything at Marie?
I was gonna second what Annie just said. I think it's so incredibly important. And one thing that we've become more aware of is what is in our benefits packages. There are things that we already had that nobody had ever really explored. And so we have, these telehealth options that included counseling that I'm the person who tells most people about our HR and benefits when they first start. And I hadn't ever been aware that was included. So, from the top down, right, making sure everybody is able to really enjoy the benefits that you offer if they include that type of assistance. But also, I think tying back to culture and flexibility, we have had some employees with a lot of extra stress, and their team leads have worked with them to, make it work for them, because, people who got sick, whose families got sick, who we're dealing with all these additional things in addition to just being in a totally different space where you're working from home, where maybe there's distractions, and it's really incredibly important. And I agree, like we all, I think, recognize its importance to a whole new level.
That's great. Okay, here's one of my favorite questions. Knowing what you know today, is there anything that you would have done differently? Anybody want to share anything? It's kind of a hard question.
Well, I don't know. I feel bad about anything we did per se, but we did a lot of pandemic preparation and a lot of different disaster recovery type preparation. I would have never guessed we would need so much PPE. So I guess I would have a lot bigger store of that. Because you end up scrambling. That's the one thing we had to scramble to get, is the masks and the hand sanitizer, the cleaning supplies. I don't know if it's even feasible to store that much on a regular basis, but yeah, that was one area where we fell down.
Yeah, I remember saying, "Oh, we have 100 masks on hand. We'll be fine." Yeah,
Exactly.
Thinking we were so prepared because we had 100 masks. Clearly,
our parent company shipped masks to the Hong Kong office because we're like, we're gonna be like ahead of this. We're gonna help our team members, not even contemplating like it's coming here next. We might need these here. So it was like, sent all this stuff, felt so good, and then suddenly it was like, oh, now we don't have any.
I think all of us now have plenty of masks and hand sanitizer on hand. But in terms of the narrower question about sort of returning to work, I guess if I could have even just 60 days ago, 90 days ago, started thinking about, I mean, we've always been thinking about how you come back to work, but we could have been a little more systematic a little bit earlier on working with the plans and communicating with our folks. So I would just say starting earlier would have been a little better. Although you know what, one of the things that's really happened here, honestly, people are like way more flexible. I mean, at one level of me, part of me thinks, oh, like we have to plan everything and work everything out. And the actual fact is, everybody responded pretty well to this whole system in terms of how they get their work done. I mean, you had all kinds of other ancillary things that didn't work well for lots of people, but just in terms of how our workforce actually operated, I was pretty surprised at how flexible people are. We kind of think in a rigid, I've said this before, but a rigid 40-hour work week. And actually nobody does a 40-hour work week. And maybe nobody ever did a 40-hour work week. So it's just, I think it's illuminated a lot of really interesting workforce type issues.
That's good. Lavanya, we know you're there.
Yes, I am very much here. So I think the last year has been a year that we've learned so much, more than we've learned and actually implemented in the past 10 years even. We had to act, and we had to act quickly, and I'm very proud of how our employees and the restaurant industry in general did as a response to the pandemic, and keeping in along the guidelines of CDC and the Salt Lake Health Department. We adapted, we pivoted, and did a great job. But the one thing is, so all of you must be familiar with the Restaurant Revitalization Fund. And when that was rolled out, we come to find out that if restaurants stayed closed, last year got back most of the revenues back, which was a bit of a surprise. However, we stayed open, we worked through the pandemic, and the lessons that we learned are so invaluable that there's no regrets there. But it was just interesting to see how some of the grants worked, where you stayed closed, you got a reward for that. So that was interesting, but I wouldn't trade the lessons for anything though.
That's great.
Yeah. Yeah.
Thank you for staying open. Sometimes the delivery person was the only person I saw.
You're welcome.
I didn't want to make all of my own food for a whole year.
So true.
Yeah. Yeah.
So true.
Yeah.
Anybody else want to share a lesson learned?
I
Share.
just had a
Oh, go ahead.
pardon me, sorry. I was just having a conversation yesterday as we were going over our vaccination numbers, and we made the choice to do a small incentive, just about $20 gift card for people once they were fully vaccinated. And then we also had a larger drawing that you could be entered into. And as we were talking about how we could move the needle now that vaccinations are starting to slow down, I think that it might have been more effective to do a larger reward for people up front instead of the smaller reward and the chance to win the bigger prize, but to do maybe, you know, $500 or $1,000 to every employee that turned in their vaccination card. And I think at the time it was a difficult choice. The EEOC has recently come out with more guidance that blessed employee incentives, but at the time that we made our decision, it was very early on, and we didn't have the benefit of that guidance. So I think we made the best decision we could have at the time with the guidance that we had at the time about what was appropriate. But if anyone's looking to do it now, and now that we have this new guidance, my advice would be maybe to increase individual incentives, and that might be more effective.
Thank you. That's helpful. Sherry?
Well, I'll just comment that I know from a major lesson learned was, if you think back to March of last year, was not only had the pandemic hit, but then we had the earthquake. So it was a big lesson learned around making sure crisis communication, crisis plans, continuity plans, right? To go in, tighten those up, make sure that we had communicated effectively across the organization, what to do, how to handle the situation, and then how to update it with so many people working remotely and virtual. We had a number of those plans and things in place, but they weren't in place under the assumption that we would be in more of a shelter in place or, working 100% virtual. So that was a great lesson learned for us.
Yeah, that's a very good point. Sometimes in our company, we have assets spread out all over the world, and our company, they always want to talk about everything that we've been through in Utah in the last year. And I always forget about the earthquake. When we're presenting about everything that we've been through in the last year, I forget to include the earthquake because it just seems like it was certainly not inconsequential for anyone who experienced damage or anything else, but it just seemed like such a quick thing that went through our timeline with everything else that we experienced last year. So it's an excellent reminder. And I do think one thing we've done well in Utah is we have drilled over and over, for earthquakes, and many of us do have good emergency plans for earthquakes. And now we've had the opportunity to develop a good emergency plan for pandemics. So hopefully everyone is keeping up with all those. There's a comment in the chat that we also had a huge windstorm last year. So that's one of the other things that, we can add to the joy of the last year. So lots of things that have happened to us in certainly the last 12 to 15 months. Just want to remind everyone who's participating with us today, if you do have a question, please just jot that in the Q&A, and we'll be happy to address that. We've got such a tremendous panel here today. I know everybody's learning so much. I certainly am. And so we want all of you to benefit from their wisdom. I guess one question that I will ask, and this is probably my last question for the panel, what advice would you give to those who have not yet created their plans?
Get on it. Now's the time. People will start doing things if you don't tell them what to do, and the things they do may not be the safest approach. So, if there's no word coming from the executive management team, smaller teams might start engaging in behaviors that really you don't want them to. So, make sure that you're communicating that you're letting them know a plan is coming, that you don't want them to change anything until you tell them to change something. Like get, like Annie said, like get those communication lines going if they're not going now, even if you don't have your plan in place yet. And then, you know, make some risk assessments that could include surveying. It could include, you know, analyzing the workflows in your spaces, and, you know, looking at, if you haven't, because you've been remote or something, if you haven't looked at things like, you know, air circulation in your building and the HVAC and, you know, the cleaning sanitation schedules, if you haven't done that, now's the time, because people want to go back to work. I think that was a great comment someone made earlier. A lot of people are missing it. They want to go back at least at some degree. So you need to make it safe for them to do that.
True. Very good points. Joe?
Just start. I mean, I'd be surprised if people had not already thought about this. So I guess I'm surprised at that. But one thing that I think is important is to not just have it sort of unilateral by some person in your HR department. I mean, it really is important to get input, both formal, informal. As I said, we did surveys, so you have an anonymous component to it, but really, you know, make this as an opportunity to actually demonstrate whatever culture that you actually have at your company. And so it's an opportunity, but pretty sure people have already started this. If they haven't, then they ought to be thinking about their culture in general, maybe. Sorry.
Thanks, Joe. Sterling?
Well, my one comment is it takes a lot longer than you think to put everything in place. And it's not just putting all the, you know, the structure in place, but then it's communicating it, and then it requires patience. People they don't want to come back. They want to come back on their terms. And so it's hard to say, unless you have a definite date, plan it out there a bit, because it's going to take them time to get ready for that. So just patience.
We say here, buckets of compassion every day. We try to have buckets of compassion. Lavanya?
Yeah. The last year has been a reset of sorts, both personally and professionally, for most people. And I think they're willing to participate and more receptive and wanting to be a part of something bigger. So it's a great opportunity to start afresh for companies and think about all different aspects of how they do business and how they participate in the community and support their workforce. So I feel very positive that you know, we have such a great opportunity to start fresh.
That's a great perspective. All right, anybody else have anything to add? All right, we do have a question in the Q&A. This comes from Aspen English. So Aspen, thank you for submitting this question. In a sentence or two, what is the biggest lesson you've learned in the past year as business people? That's a great question. So somebody want to go first? One that requires a little thought. I would say what I just said. I think that I think we need to try to approach every situation with a lot of compassion right now. I've tried to learn to be a more compassionate leader, and something that I think Sterling just said, which is to be more patient with everyone all the time. It's a work in progress, but certainly something I'm trying to do. Sterling?
I guess the one lesson is you can never over communicate.
Right.
They want to know where you stand, what to expect, and as much as you communicate, boy, makes a big difference.
Well said. Well said. Anyone else want to share?
I think it's taught me to be a much more flexible person in my approach to the way I do business. You know, I'm general counsel for our company. I'm all about policy and risk and doing it the right way and checking the boxes. And I mean, you know, I issued an updated COVID policy to our company, and literally a few hours later, the CDC changed its guidelines. And I had to say like, okay, we're going to change it again. And like, I'm going to communicate that and I'm going to explain it to my employees and we're going to change, like, even though I just changed it this morning. So I think I've learned a degree of flexibility that I've never had in my business life before. That's where I like to exercise control. And this year took some things out of my control.
Well, as someone who spends a lot of my time every day working with a lot of legal professionals, I just want to say thank you for being flexible. Joe?
Well, I mean, the flexibility has been kind of an undertone of a lot of this, flexibility and compassion. I'm just pretty amazed at how people sort of pull together to get work done. I mean, at the very beginning, and I was in this company right at the very beginning of the COVID, but I think everybody was thinking, how can this work? How is this actually going to work if we don't have people coming to work every day? And pretty soon, guess what? Everything was working. Yeah, IT still worked. People got what they needed to get done. I think another impact of this is that's going to be way less travel going forward. I mean, I myself traveled like to some remote city just for a meeting, and I'm thinking, okay, for me, the threshold question now is, can I do this on a Zoom? Now, a lot of things that you can't, if you have multiple meetings a day, but my first question is, hey, I'm going to talk to my lawyers. Speaking of Marie there, if I have lawyers in New York, I can talk to them on Zoom, and I don't need a face-to-face. So that's just yet another kind of thing that we're learning out of this whole big, long, bad episode.
Yeah, that's great. We just have a few minutes left, but I'd like to hear from everyone else. So Analise.
Yeah, I don't know if I can distill it down into one thing, but I have been impressed by just the importance that I've seen of communicating care and that we care about our employees' well-being in general. I redid a couple bonuses just saying, hey, we know that you are all very overworked right now and you're probably stressed out about COVID and a whole bunch of other things. We're not going to ask any questions. Everyone across the board is going to get a bonus. Or we show care by, we're going to make sure that everyone's wearing masks and that we're communicating to everyone on our job sites what the expectations are. We're going to have the PPE or the cleaning there. But there were just a lot of actions that were taken that communicated that we care about your well-being. And because of that, I'm just really proud of our team and how everyone excelled. And the morale was very high. And in turn, they showed that they really cared about their job and their role and did really good work in a really challenging year.
Yeah, thanks for doing that. That's terrific. Sherry?
As a leader, I was reminded of the power of human connection and solidarity, especially in a time where we spend so much time talking about diversity and inclusion, which is wonderful. But through the pandemic, I was reminded that we're more alike than different, and the solidarity that can come from remembering from time to time to remember that and remember that that as humans, when we connect, it can be powerful and that those things are important to people.
That's a great comment. Thank you so much for that, Sherry. And Lavanya?
I think the one thing that we realize is change is constant and being flexible is not an option, it's a requirement. And not trying to control too many things, just realizing that some things are outside of our control and to be flexible and adapt to change, something that we learned. But I also love Sherry's comments about how we all came together. And as a community, I couldn't agree more with that, because we've seen, just being in the front lines, people, business organizations such as the Salt Lake Chamber always being there to support small businesses, medium businesses, large businesses, just kind of wade through the pandemic, and as well as the community coming together to support us. And one example I'd like to mention is, a club called the $100 Dinner Club that Mary Crafts and Kate Strong have started, where 30 women pull about $100 each every month. and they go to a restaurant and give the $3,000 to the servers there. I think it's pretty fabulous what the community has done, and a big shout out to them, and so many other projects that the community has taken upon themselves to be responsible and to show compassion and love. So thank you.
That's great, Lavanya. Thank you. Well, what a terrific panel. Thank you so much to all of you for your excellent comments today. And I know that everyone who's participating today learned so much from all of you. So thank you for your time and the energy that you've invested in participating with us today. As a reminder, this webinar was sponsored by the Salt Lake Chamber's Roadmap to Recovery Coalition. If you'd like to learn more about how you can get involved or to see a recording of today's event, please visit saltlakechamber.com, slchamber.com. Thanks again to everyone and have a great day.
Thank you.
Thanks so much,
Bye-bye.
Linda.
Bye.